So not to jump in, but students, we are going to record this session for both Maine Township's purposes, so we can reshare with some students who aren't here. If you want to go back and re-listen to the video, we're going to be, or have that option to do so. And then also Advocate Aurora Lutheran General is going to use this recording on their YouTube page. So if you do not feel comfortable with your cameras on, we want to make sure that you're aware of the fact that it will be recorded. And that's why we asked for you all to change your name to just your first name for this one.
Okay, all right. So good afternoon and welcome. My name is Wendy Ruti and I work in the Medical Education Office at Advocate Lutheran General Hospital. I want to take a moment to thank Ms. Buchberger for giving us the opportunity to present to you the journey to becoming a physician. Just as she said, just as you are aware, we are recording this presentation so that it is available to those who are unable to join us. So if you do not want your image on the video, please feel free to turn off your camera and we will get started. Okay, so at Lutheran, we have been teaching physicians since 1961. That's 60 years of training doctors. So we know a few things about the path to becoming a physician, and we have a great team here today to drive you through it. We will offer information on the path to medical school, residency, and fellowship. Along the way, we will take a moment for a discussion with our physician panel. We have a wonderful representation of our residents, and they will share their career journey and entertain your questions. I encourage those who have questions to type your first name in the chat box at any time during the presentation. When we go to the panel, Maggie Petrie, who is our manager of medical education, will read off the names in the chat box. I ask that when your name is called, please unmute your microphone and ask your question. We want to engage all of you on this journey, so at the end of this presentation, we will announce some prizes. The first 5 students who are asked questions will win a prize, but don't worry, everyone who is here today will get a token of our appreciation for joining us today. So let's get started on this journey.
Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do.
So thanks to Leah Bremen, the daughter of one of our team members, who graciously recorded that video for us. Wouldn't it be great if becoming a doctor could happen in 30 seconds, just like the TikTok video? In reality, it takes years of education, dedication, and training. On top of that, there's a serious financial commitment along the way. I'm going to turn it over to Angela, who will get us all started on how exciting this journey can be, and she will begin with medical school.
Thank you, Wendy. My name is Angela Randazzo, and I am the program specialist in the internal medicine residency program here at Lutheran. The journey begins after 4 years of college and choosing to take the medical college admission test known as the MCAT. The MCAT is a standardized multiple choice exam intended to help medical schools assess your knowledge in determining your admission to medical school. You have the choice of applying to medical schools that offer either a Doctor of Medicine, also known as an MD, or a Doctor of Osteopathic Medicine, also known as a DO. The 2 degrees reflect different types of medical school training. MDs attend allopathic medical schools, while DOs attend osteopathic medical schools. They both have the same rights and responsibilities in regards to treating patients. However, DOs have some extra training in the musculoskeletal system and receive additional training on osteopathic manipulation treatments. It can be described as a more hands-on healing method. Both types of schools involve a 4-year program where you will get academic as well as hands-on learning experiences. Some students may choose to go outside of the United States and apply to international medical schools. At Lutheran, we are fortunate to train nearly 1,000 medical students each year. We have affiliations with the University of Illinois at Chicago, Rosalind Franklin University, Chicago Medical School, and Midwestern University, Chicago College of Osteopathic Medicine. However, we also have medical students from various schools from all over the United States. I will now turn it back over to Wendy.
Thank you, Angela. So now it's time for our resident physician panel. To help things along, I will pose the first question, and I ask the panel to please introduce yourself prior to answering this question and to respond in the order of the pictures on the screen. We will start with Dr. Ali. Dr. Ali, if you are online, I will ask, what was your college major and did it help you when you went to medical school?
Hi everyone, I'm DeRay. My college major was biology. I think this is somewhat of a misconception. People think that they need to have, this is just my opinion before I say it, that they have to have a science major, something to do with biology, chemistry, to be able to pursue medical school. That's something that I thought too, that it would help me with my career. So I ended up doing a biology major. In hindsight, I don't think it's something I absolutely needed. I could have majored in finance and still been to medical school. There are certain courses that you are required to take before medical school. Lots of medical schools will require you to take a year of biology, chemistry, physics, organic chemistry, and all those things. It's easier to do those things if you are a science major, because then you don't have to do something extra. I would say it helped me just realize how much I liked it. But it's not absolutely necessary. You just need to take pre-med courses to be able to pass the MCAT, because what medical school require is what's on the MCAT. I would say feel free to explore, as many other things as possible. I ended up doing a minor in sociology and history, so.
Do we have Dr. Arsenal done?
Yes, hi. I'm Victoria, one of the PEDS residents. I went to Michigan State for undergrad, and I actually got a degree in nutritional science. And I picked it because I actually just was interested in it. It was one of the sciences I had read about prior to going to undergrad, when they give you like the pamphlet of like majors to pick. And I just really liked it. And my reason for picking it was because in case I didn't get into medical school or something changed along the way, my fallback would have been becoming like a registered dietitian, just because I liked it. But I had friends in undergrad where I had a friend who went to medical school and their major was in music. And I have some classmates in my residency class now where their major was in accounting, or they were a lawyer before. So you really can pick any major you want, because you have to take a certain number or a certain amount of classes in order to get into medical school, but you can major in anything you want.
Dr. Chin?
Hi, I'm Ashley. I'm one of the psych residents. Just going off of what everyone else has said, I'll, just briefly, I majored in biology as well. I thought it was really helpful in getting all of my pre-med requirements done. And I also majored in it just because I liked it. I started as a chem major, realized I hated it, and realized I like my bio classes. So I just did what I liked, and it just so happens that it helped me finish my med requirements. So do what you like, or else you'll be miserable.
Dr. Curry?
Hi, I'm also one of the psych residents. I majored in classics, like Latin language. I really liked it in high school. Similar to what the first two residents said, you can really, and Ashley too, you can really, I felt like major in whatever you felt was interesting. I kind of felt like I wanted to major in something that I really liked and I probably wouldn't learn about anymore in medical school, because I knew I was going to learn a lot of science. You have to do the prerequisites anyway, but like organic chemistry, biology, and that stuff. But I felt for me it was a better balance than just doing a ton of science, and I could still do some like humanities. And I think for some med schools, they, I think you can really do whichever you want.
Okay, we'll have Dr. Kolivas next.
Hi guys, I'm Sophia. I went to Loyola for my undergrad and I actually studied chemistry because I kind of hate biology. I don't like studying the trees and the birds and the animals and everything else that's part of biology, but I also studied finance. So I think the thing that's most important is if you're studying something that you're really enjoying and you really like, that's going to echo a lot more when you apply to med school and when you move on into life, as opposed to just doing something that you feel like you have to, because then it's a chore.
I think Dr. Kolangara is not on yet, so we have Dr. Lawler.
Hi guys, I went to Augustana College out on the border of Illinois and Iowa, and I majored in biology and neuroscience. Again, just kind of like everyone else, it's a wide variety of majors and what you do in undergrad, but all the experiences will bring you opportunities to talk about in medical school for sure.
Thank you. Dr. Mullinex is next.
Hi guys, I'm Tom. I'm one of the third-year psychiatry residents. So I actually majored in journalism, so I only took the basically bare minimum science courses that I needed to apply to medical school. I enjoy science a lot, obviously. I enjoy medicine, but my passion at that time was writing. I enjoyed writing a lot, so I majored in journalism. And like everyone else said, it just goes to show that you can major outside of the science. You don't need to be a biology or chemistry major. You can major in whatever you want in college, theater, music, art, whatever. You do need to take the, enough science courses to be able to understand and be able to sit for the MCAT, but certainly don't have to major in biology, and I'm very glad I did not.
Okay. Now we have Tabitha, Dr. Tate.
Hi, I'm Tabby. I went to UW-Madison for undergrad, and I actually studied psychology there. I was able to kind of tailor my classes, and so I took a lot of classes that were more geared towards development and learning and those sorts of things. So I do think that was helpful, but I agree, it's just, what you care about the most. I think college is a really good time to kind of explore different fields and take different classes. You'll have plenty of time to learn medicine in medical school, so try to learn something else in undergrad.
Okay. We have Dr. Va.
Hi, my name is Vera, and I'm one of the second-year psychiatry residents. I went to Loyola, and I majored in molecular bio. So obviously, I got the prerequisites out of the way, but like other people said, there's plenty of time to still do what you enjoy. Like I minored in English because I like to read and write a lot. So, and I definitely had time to do that.
Okay. And I believe Dr. Zaki will be joining us later. So we'll now open the floor to student questions. As a reminder, Maggie will call out your names and that are in the chat box. And when your name is called, please unmute your microphone and ask your question. Don't forget to mute your microphone when you are done. So Maggie, do we have anyone?
Dana?
Yeah, hi. I was just gonna ask, did you guys know like you wanted to go to medical school or go into the medical field from high school, or did you like know that like during college?
I can start with this one. I was definitely on a track towards chemistry. Like I thought I wanted to be a chemist and purely work in the chemistry industry. And I tried to stay away from medicine actually because my father's a physician and he just worked a lot. But as I continue to have more and more experiences with college, I just kept like coming back to medicine and feeling that I really wanted that human connection. And so it wasn't until maybe my third year of undergrad that I like fully decided, yes, I'm going to medical school.
I can go off of that a little bit. I thought, I think realistically, if you have an idea that you want to go to medical school when you start college, I think it's a good idea to kind of start taking some of the classes, because if you start a little later, you might have to like double up on some things. I still think it's doable, but I went into it thinking I really like medicine. I like the idea. And so I wanted to like cover my bases, and ended up applying and love medicine, but I kind of came into it more like, I'm not sure what I like, but I don't want to rule anything out, I guess.
All right, Amy.
How competitive is residency?
Was the panel able to hear the question?
Was it how competitive is residency?
Yes.
I think it's more competitive to get into medical school, and then each step afterwards, it gets a little easier because there's fewer people in the pool that are taking the spots. With that said, you take multiple exams along the way, your grades, your letters of rec, everything else kind of help build you to make you a more competitive candidate. So I personally think the harder step is getting into medical school, and a lot of times people don't get in there first time. I didn't get in the first time I applied, and I took a gap year and got a master's degree, which is what a lot of people end up doing.
Thank you.
I think too, for residency, it's really, it kind of depends on what your goals are. So I think some people really want to go to one school and have that in their mind, whereas a lot of people will, apply really broadly, and some people are open to, going out of the country and those different things. So it kind of depends on what your priorities are.
Thank you. Athena?
What is your work-life balance like?
Work-life balance.
So I can start here. I think the psychiatry residents can agree that psychiatry, so it depends on your specialty. I think we have, I'm having a hard time reading, but I think there's internal medicine residents. I know there's internal med and peds here, so I'm sure everyone can give a little bit of a different idea, but I think, work-life balance is something that I'm glad someone asked about, because I think oftentimes we're scared to ask those questions and shy away from, talking about that. But I think that is really important. So I would say that you can have a nice work-life balance in medicine. Residency might not be the time that you get that, but, like any job, after you are finished with your training, you can set up your, the way you work, more or less the way you want to. Certain specialties are going to be more intense. I don't think there's any surgical residents here. Those specialties are going to be much more intense.
I can talk about that whenever you're done.
Perfect. I'm basically done. I was going to say, if you, if work-life balance is really important to you, I would never go into anything that you're not interested in. But certain fields, psychiatry being one of them, lend themselves to more of a work-life balance. But if there's a surgery physician here, I'm sure he could give more info on that.
Yeah, I think Rohan was probably going to say something. I think he's surgery, but I'll just chime in and say I'm also a psych resident, and I do appreciate work-life balance. Even just going into medicine, just going to medical school, you do sacrifice a lot, though. It's not something easy that you choose. If you're looking for, work-life balance in terms of not working as hard and things like that, it's definitely not the right path to choose. So no matter, what field you go into, just going to medical school is a big sacrifice, but you can carve your path the way you want it as you go further. But it's not a walk in the park.
Okay, can we have another specialty like internal medicine, family, or surgery speak to it, or pediatrics?
Sure, I can speak for medicine. Like everybody said, it's really dependent on what specialty you choose to do. Certain specialties have more hours than some, but regardless of what you choose to do, residency is a time where it becomes a little bit difficult. It's not impossible, but you're not always going to be able to take days off during holidays. You're not going to be able to always make it to your friend's wedding or your family events. Sometimes you're going to have to miss those. It takes a lot of trial and error. You try to balance things, and it's definitely not impossible, but it is a lot of hours, lots of hard work. All of medical school, all of residency. I haven't done anything beyond residency, so I can't speak for it, but it's definitely a commitment. But that being said, people still have families, they're married, they have children, they're able to do everything with life. It's, doctor is not who you are, like it's what you do. It's just like, people have other tough jobs, difficult hours. So it's something you have to really work on yourself.
I can talk for family medicine. I'm one of the second-year residents. Like everyone said, kind of medical school is its own beast, and then when you get into residency, it's more work, and there are different kind of commitments that you will, like they said, miss different obligations or things like that. But as you continue on, our first year is more intense, and then second and third year proceed to be more, I would say, more balanced. And then when you get out into the attending life, you can kind of build your schedule, understanding that you may have harder times than others, but you can kind of build it to what you want.
Thank you. Let's go to Daphne.
Hi, I'm Daphne, and my question is, what was the process of choosing your specialty like if you didn't already have one in mind? Like, how did you explore all the different specialties in your own way?
So medical school forces you to kind of rotate through everything, so you get to have a touch of everything. And I went in with everything with my blinders off, but I got bored of stuff very quickly, which kind of told me that I needed to do something that I could jump from specialty to specialty or see multiple different things, which kind of led me to internal medicine, where we get to see a wide breadth of everything without being too focused on one section.
I think a big thing when you're in medical school, you'll either decide if you want to do surgery or if you want to do more medicine-based care or more like procedures. I shouldn't say general surgery, but if you want to do clinic and spend a lot of time, more interacting with patients in that fashion, or if you want to be more procedural-based, whether it's doing like GI and colonoscopies and endoscopies, or ophtho and eye procedures, or if it's doing surgery and the variety of surgical fields. But I think that's kind of the first step that a lot of medical students come to. And then it's picking what they want to do inside their fields. But you do get plenty of exposure throughout medical school. And you have time usually to pick kind of things that you think you might be interested in. I thought I was interested in neurosurgery. And, 5 months into my third year, I did a rotation, and I decided that was not what I wanted to do. So the work-life balance, I saw the neurosurgeon 18 hours a day, every day. He wasn't seeing anybody else but me either. So.
All right, thank you. Jada.
Hi, how do you cope with stress when your job gets to be too much?
How do you cope with stress when your job gets to be too much is the question.
I can start with this one. So finding people to talk to, really. So in any area of medicine that you do, or any level, starting in undergrad, into medical school, into residency, find a group of people that you can talk to. Talk to those friends, talk to your family, just talk to people often. Let them know how you're feeling. If you're feeling stressed, if you're feeling down, if you're feeling upset, or even in your triumphs when you're happy, talk to somebody. It really helps along the way, especially being an intern now. notoriously one of the tougher years of residency training. And there's a lot of times when you doubt yourself, and that's normal along the journey. But if you have someone you can reach out to and express how you're feeling, that always helps. So just reaching out and talking to people often.
Okay, Thomas. Thomas, your question? Okay, let's go to our last question, Morgan.
So earlier you guys were saying how you majored in different things in college. When applying to med school, do they look into like what you majored in when making their decisions?
So I actually helped interview people for medical school when I was towards the end of medical school. So actually things that we looked at more was your experiences, things that you did for fun and things that you did that made you a more well-rounded human. Yes, your grades are important. So I would choose something that you're interested in so that you get good grades. And yes, your MCAT is important as well. But a lot of questions on your interviews are about these like ethical decisions or these scenarios on how you would behave as a human and how you would interact with your peers. So I think a lot more of that is indicative of how a medical school would choose or not choose you based on those other types of things and not purely your major.
Anyone else from the panel?
I have something. I think it's not necessarily what your major is, but it kind of depends on what you do in your major. So if you're in biology, did you do research in biology? Did you join different groups? Did you, how did you apply that to the rest of your college experience? So, I mean, I had quite a few. I did some research with like rats because I was in psychology. And so, that came up pretty frequently just, as a way to ask what you did. So I think the major probably not as much, but there's different opportunities in different majors which might come up.
Thank you. Great questions. Thank you, students, and thank you, panel. We're gonna hand it back off to Wendy.
All right, thank you, everyone. So we now move on to Afsha, who will take you on the next step of our journey, residency.
Thank you, Wendy. My name is Afshan Woodridge, and I am the supervisor for the internal medicine program at Lutheran. After you graduate from medical school, you can celebrate. You're officially a physician. Although you are now a doctor, additional training is needed in the form of a medical residency. So let's back up a little bit and talk about the last year of medical school. This is the time when medical students decide what specialty to go into. You will apply and interview at residency programs based on your area of interest. After you have interviewed at different programs, you will submit a list of your preferred choices to the National Resident Matching Program, also known as the NRMP. The residency programs also submit their preferred candidates. The NRMP then uses an algorithm similar to a lottery to select their students to the residency program. This is called the match process. In March of each year, medical schools and residency programs celebrate Match Day. This is the day that the NRMP releases the results of the algorithm, announcing the matches between the medical students and the residency programs. This is a very exciting time. Residency involves specialized training in your area of focus. The exact skills and procedures you will learn differ for each specialty. For example, you may learn different skills as an internal medicine resident than you would as a pediatric resident. In general, you will be responsible for assessing patients and performing physical exams. Residents also order appropriate diagnostic tests and consult with other specialties as needed. The length of your residency depends on the specialty you are pursuing. Most residencies are between 3 and 7 years. During your first year of residency, you are likely to be supervised closely by senior residents and attending physicians. As you progress in your residency, you are given more responsibility and more independence. Most residency programs are accredited by the Accreditation Council for Graduate Medical Education, also known as the ACGME. It is an organization which sets standards and monitors the educational practices within residency programs and fellowships. When your residency training is complete, you will graduate and able to practice medicine independently. This means that you no longer are in training and can practice medicine without being supervised. At Lutheran, we have residency in 5 specialties: pediatrics, internal medicine, family medicine, are all 3 years in length. We also have obstetrics and gynecology and psychiatry, which are 4 years in length. I will now turn you back to Wendy.
Thank you, Afsha. We will go back to our physician panel. Maggie, do we have any additional questions?
Waiting for them to come in. Please type your name in the chat.
While we wait for questions, maybe I can ask a question for the panel. Have you ever been told that you would be good for a specific specialty and you felt like you just did not want to go to in that specialty?
I can take that one. Hi, so I'm Rohan. I'm a PGY2 surgery resident. Just quit my path to med school. I did a combined 7-year BA/MD program, so I applied for that after high school. I think the program was worth it, and it gets you to your path quickly. So yeah, regarding that, I was always interested in surgery. I never really wanted to do anything else. I just didn't find anything else kind of as fun as surgery. But in med school, and especially undergrad, I felt like we got a lot of exposure to like primary care and medical specialties. And then in med school, my med school was very primary care focused, and internal medicine was very strong. So we really had a lot of exposure to that, and I was told by a lot of our like faculty mentors to do medicine. But I would say in that situation, kind of, I made my decision off of just what I found the most fun and interesting. I didn't really pay attention to like lifestyle or anything like that. I feel like in surgery, definitely it's going to be, you're going to work more hours. The residency is significantly more demanding physically. And then you kind of just see if what's worth it to you. If being able to operate at the end is worth it, then you kind of just go for it. So that's why I would say when you end up going to med school and trying to decide what you want to do, I basically just chose what I found the most fun.
Thank you. We have a question from Ria.
Yeah, what is being on call like, especially for the psychiatrists?
I can take this one. So, again, Viren, one of the 2nd-year psychiatry residents. Call for us specifically at Lutheran General is not too bad, honestly. You're like the only psychiatrist there, but you always have an attending that you call, like when to talk about your patients. And our calls we only do short calls now, so there's none overnight, and it's from 5:30 to 10:30. So it's very doable. I know other psychiatry programs, they do overnights. So it just depends on which psychiatry program you get into, but ours is not bad. And during like the intern year, you do it about once a week. When you're a 2nd year, you typically do it 3 to 4 times a month, and then it gets like less from there. But yeah.
And what psych call entails is basically taking calls from the ER. So anytime someone comes in to the emergency department, has any sort of psychiatric presentation, sometimes neurologic as well, if it's like dementia with agitation, or even sometimes there's other interesting neuro cases that we'll get involved in. But obviously, if anyone comes in with a psychiatric presentation or a safety concern, then we're called down to the ER to evaluate them, and either admit them, discharge them home. We don't start medications in the ER just from a safety standpoint, but we mostly handle what their disposition is going to be. And like Bjorn said, it's primary, it's 100% out of the ER. I think that's pretty typical for what being on call is for psychiatrists, since you asked specifically about that. We used to do, as Bjorn said, we're doing all short call here, but we used to do overnight call. And I think if you were to do a psychiatry residency anywhere, you'd probably get a mixture of that overnight and short call. And I think call is, as I'm sure other programs feel, it's kind of when you build your independence and confidence in making decisions, because again, like Bjorn said, we're the only person here in the building right at that time. From that specialty, we have our supervisors available by phone, but you get really good at making decisions for yourself. So since you asked psychiatry specific, that's how it is here.
Thank you. Daphne.
What would you say the hardest part of medical school was?
I think for me, the hardest part was building confidence. It's very hard. You have to like hit the ground running. You get thrown a lot of information. You've got to build kind of a good study strategy, but you also have to be pretty confident in yourself that you know your stuff. You are putting in the effort, and when you put in that effort, it's worth it, and you have good positive outcomes. And I didn't have a very good support system starting out medical school, which I developed throughout medical school and residency. And so I think that for me was kind of the hardest thing, feeling kind of alone. But an easy way to combat that would be to have some sort of support that we kind of talked about earlier for work-life balance, and then also just, have that confidence that you're in the right field and you know your stuff.
Yeah, I'll say kind of just the sheer volume of things. You'll hear the cliche many times, but it is like drinking from a fire hose. There's no time to really fall behind. If you do and you're starting to play catch up, it just gets harder and harder. So trying to make sure you're staying on top of everything and doing things in the timely manner, I think, is very important.
Just adding to that, I think it depends on what medical school you go to. My medical school was very testing heavy. So coming from undergrad, it's pretty common to have tests every once a month or once every few months. You don't get tested as frequently in undergrad. But my medical school, a lot of times I had multiple exams in a week. So it just constantly felt like a hamster on a wheel, just keep going. And that was difficult because I was not used to studying every day. You have to kind of build a habit to study most days of the week.
All right, thank you. We're gonna go to Jada.
My question specifically for the pediatric side of medicine, how many hours do you work a day?
So that was for pediatrics.
Yeah, so pediatrics is kind of split into two different areas. So you can do outpatient pediatrics and more like the inpatient pediatrics, which has, there's all this subspecialties that there are in adult medicine. They have them in pediatric medicine too. In residency, our hours vary pretty significantly based on rotations. We do like 5 months of the year is inpatient, so we're on the floor. Those are long days. We end up working from like 6 to 6 usually, and then sometimes you'll work overnight. Our program has it set up where we have a 3+1 schedule. So our blocks are 3 weeks, and then we have a week of clinic. So our clinic week is usually pretty light. So we only end up working like 30 to 35 hours a week instead of when you're on the floor and working much more. And then it just kind of varies by rotation. But we put in a good amount of hours.
Yeah, I'll kind of go off that too. Definitely in residency, the hours vary, like Tabby was saying. When you start to go further in your pediatric career and you're trying to decide inpatient versus like an outpatient. The hours are in the outpatient setting are pretty standard. I would say like between 30 and 50 hours, depending on what your pediatric practice is. And then for an inpatient or subspecialty setting, it's kind of dependent. So in some subspecialty fields, you can pick and choose when you're on call if you're part of a group and when you want to work. So there's some leniency. So if you choose to go into pediatrics, you can really tailor what lifestyle you want with whether you decide inpatient or outpatient. So it kind of varies, but it's definitely very hour heavy in the beginning of your pediatric training.
All right, Emily.
Okay, yeah, so I was gonna ask, like, I feel like residency, like, compared to medical school is a lot more, like, hands-on, and then you're, like, out in the real world, so, like, when you started, and this could go for any specialty, when you started residency, did you feel, like, really overwhelmed, or did you feel like you, like, knew what you were doing, like, you knew your stuff?
I don't know if you ever feel really like you are ready. Each step is a brand new challenge where you're kind of at the beginning of a new road. And so day one is kind of a shock, like, oh my gosh, I have to do all of this. But then as you go on and the days continue and you look back, you see how much you've learned and how much you've grown. So I think each step is scary and terrifying in its own regard, but you learn so much that you're more than prepared, even though you don't feel like it.
In medical school, it tries to get you ready. So in my medical school, the first 2 years were really book heavy, where you just studied and did that. And then the second 2 years of medical school is when you like actually go out and do rotation. So, and you theoretically get a little bit more responsibility as you go forward in medical school. And then you'll do like a sub internship where they'll try to treat you like an intern to see how that's like. And so they kind of try to help you be prepared. But it feels like a very different role as much as you try to be prepared.
But it's so exciting because you finally get to like work with people. It's great.
All right. Athena.
Hi, my question is, what is your day-to-day like when you go to work, and do you take any work home with you, and what does that consist of?
I can start. For the family medicine side of it. Our intern year is more hospital based. It's more 6, 7 in the morning until 5 p.m. or so. Second and third year, you spend more time in the clinic. So like today I was at the hospital from like 8 till 1, and then was able to come and do this. But generally, if we're in clinic, it's 9 to 4, 5 p.m. And we have charting and stuff that we have to, all of us have to do. But when you see, 10 to 15 patients a day, you don't really have time to do all of that. So you'll sometimes take that home or try to accomplish it in between patients the next day or something.
Yeah, for us, when you're not on call, our program is kind of very good about duty hours for the most part. So I'll come in around 5:45, 6 a.m. And then most days you're out of here by 5 p.m. Granted, there's no cases or anything like that going on. When you are on call, you show up at about 6 a.m. and you go home the next day around 8 a.m., 9 a.m. And then we don't take anything home with me.
I have a 2-year-old son, so I definitely try to leave everything at the hospital. And when I leave, it's cut off. So my home is separate from my work. And you can definitely do that in medicine. You got to keep up with your work and everything, but it can definitely be done.
Okay, final question. We have Amy.
It says that Amy's microphone.
So yeah, so her mic's not working. What's the hardest thing about being a doctor is her question. What's the hardest thing about being a doctor?
For me, I think it can sometimes be emotionally very challenging. Before you actually do medicine, like, back in undergrad when I thought I wanted to do medicine, I didn't think about, I thought everything was, very happy. All you do is fix people, but sometimes there's, you can't save everybody. And initially that's very difficult. Like, I hadn't really, sorry if this is maybe too much, but before residency, I had never seen somebody die in front of my eyes. And the first time I had to see that was my intern year, the first time I started residency in the ICU. And that was emotionally difficult for me. So.
It's also really difficult to miss out on holidays, especially if you are someone who's never missed a Christmas or never missed, any holiday with your family. You're going to start missing those and be studying or at the hospital, and that can be a really difficult thing as well.
I think that was a really good point you brought up. Oh, sorry, go ahead.
Oh, no, go.
I was going to say the studying thing, that's something that unfortunately is just part of the game. So compared to a lot of my friends went into like finance and other non-medical fields. And as a physician, you are kind of constantly studying. So a lot of your time, especially in med school, will be to studying. And then in residency as well, unfortunately, you do still need to study a lot, if so, almost the same amount as in med school. And that's just a kind of a process throughout. So you'll see like a lot of times when your friends are done with work at 5, 6 or whatever, they can go out and do whatever they want. And oftentimes you'll be studying, doing research kind of. So that's just something to always keep in mind. That's something that I did not know about. And unfortunately, it's just what comes along with it.
Tabitha, were you going to say something?
Oh, yeah, I think my thoughts kind of go along with those, is that I think at one point we all realized that you can study every free second of every day, you can try your hardest, do your hardest, but you can't know everything, and you're going to miss things. And I think that's a lot to kind of deal with mentally, especially when we are working really hard and trying really hard, but just that you really can't know everything.
Anyone else from the panel? All right, we got one more question. Kristen.
Yes, I see we have some MDs and some DOs. Can you just talk a little bit about how you decided which path of medical school to pursue?
I'll start. That's where I got in. I applied to both, and interviewed at both, and got accepted to CCOM, and that's where I went.
I'm so glad Dr. Lawler said that, because that's what I was thinking too. I applied and it's where I got in. I mean, they're treated very equivalent in the world. So that's what.
Stephanie?
Yeah, hi. So my question is, did you ever think about changing your career path while you were far along in your studies?
Did everyone hear the question? it was a little hard to hear. Can you speak up a little bit, Stephanie, and repeat the question?
Yeah. Did you ever think about changing your career path while you were far along in your studies?
Have either one? Go ahead.
There were many times that I, thought about changing my career path and throwing in the towel. And you just need to take a step back, I think, at some of those times and see, is this really your passion or not? If medicine truly is your passion and what in the deepest, darkest corners of your heart, what you really are going to be happy doing, you're not going to be happy doing a different career. And that was my answer continuously. So you'll have those second guessing thoughts, but if it's really your passion, that's your path.
Adding to what Sophia said, I second guessed many times because medicine for me was something I thought I wanted to do ever since I was a kid. So as I grew up, I was like, maybe this is, something I wanted as a kid, but don't really know what it's like. So I actually ended up doing some accounting classes, some engineering classes. I even worked in an accounting firm, and I tried to explore everything else, but really nothing made me as happy as medicine. So for me, I personally think it was a good idea for me to explore other options and really know what I'm getting myself into is what I really want to do. So now I feel super confident in what I'm doing. I never think, oh, I wish I did something else, because I know I tried to do some other potential things and nothing else made me as happy as medicine.
Yeah, I just want to add on to that. I completely agree. Medicine is such a commitment. And I kind of knew that going in. So after undergrad, I took a couple years off and was just kind of doing my own thing, tried to see if there was something else that I would rather do. And I worked at like an optometry office and then did some other stuff. But after like those 2 years, I still wanted to go into medicine. So when I did have those thoughts, like during med school, like when things got rough or like during rotations or residency, I just remember that time where I took those 2 years and was like, yes, this is what I want to do,
Yeah, I think if you were to ask any physician, they would be able to pinpoint like 1, 2, even a few times in their career where they had to take a pause and were like, wow, is this really what I want to keep doing? Do I want to continue on this path that I'm on? And every single time, like in my instance, I didn't get into an American medical school. So I was like, nope, this is what I want to do. But I took a long pause and I was like, is this actually what I want to do? Do I want to go to a different country for medical school and continue on this journey? And in reality, I did. I was like, there's no other career that would make me happy. I want to keep pushing myself. And so that's what I did. There's going to be multiple roadblocks in any career you choose. Time goes by. Pick something that you like to do.
There are also a number of people who start on this path and realize it's not for them and then are able to change careers. So don't also feel like if you go into undergrad with pre-med on your mind or even start applying to med school that you're kind of stuck on that road. There's multiple exits along the way that you can get onto a different highway.
All right, thank you. I'm going to hand it back to Wendy.
Okay. So our final path is through fellowship, and Afsha will be here once again to present.
After residency, you may choose to continue your training in a fellowship program. Fellowships are a higher level of specialized training and take anywhere from 1 to 5 years, depending on the specialty that is chosen. Doing a fellowship is optional and is not required to practice medicine, but is necessary for advanced training in a specific specialty. You can also choose to do multiple fellowships. An example of this would be a resident who finished their medicine residency training. They might go on to a cardiovascular fellowship and then decide to continue on to an interventional cardiovascular fellowship, which would provide a higher level of skill in taking care of the heart. Fellows are capable of acting as supervising physicians in their specialty. For example, a gastroenterology fellow can supervise an internal medicine resident because gastroenterology is a subspecialty of internal medicine. Overall, there are over 50 different specialties of fellowships that you can choose from, depending on your residency. At Lutheran, we have 8 fellowships, which include gastroenterology, hematology-oncology, cardiovascular, minimally invasive surgery, colorectal or gynecology, sports medicine, pediatric critical care, and neonatal perinatal medicine. Now I'll turn you back to Wendy.
All right, so we are back to the panel for questions. Maggie, do we have any?
We have Casey.
Yeah, I was wondering, so, do you need like your master's degree to like get a decent job like in the healthcare fields or like what you want to pursue? Or like is it possible you can just get your bachelor's and just like be done and move on to like training and stuff? Or how does it work?
I think you'll see some people sprinkle in with masters because they don't get into medical school right away, or we're unclear if that's truly our path. You only need a bachelor's degree in order to get into medical school. You do not need a master's or anything else. It's just kind of fluff for you.
Were you asking about to be a doctor though, or to like do something else within the healthcare field?
Just like anything, like a stable job or like what you want to do in the healthcare fields. I know it depends, but just like a decent job, I guess.
I think you could find a lot of jobs in the healthcare field with a bachelor's degree. I think a lot of research, it's people go on and get a master's or a PhD, but is there something you're interested in that you're curious about, like research or like nutrition or something else?
No, I was just like thinking
Just
about
broad.
like, general.
I'm sure you could find a very nice job at every stage of education. That I'm sure that you could get into something very life-changing and where you can help a lot of people with a bachelor's degree. I think it just kind of depends on what your interest is in continuing with education. So if you want to become a physical therapist, then you're going to have to get a bachelor's degree and then go on and get a doctorate in physical therapy. If you want to be a dietitian, I actually don't know the route there, but I think it's a bachelor's plus or minus a master's degree. If someone can correct me on that. But the point is, I think we are all here with doctorate degrees, but I want to just really drive home the point that you can get into the health field and do something very very good without needing to go this far in your education, because it's not for everyone. And if you wanted to go to college or get a certificate in something, there's a lot you can do in the health field. And I think that's a really important point, because today's hearing from a physician panel, and as a resident doctor myself, I wouldn't want to do anything else. But I think that for some people, there's you could do a lot with a bachelor's degree. You can do a lot with less than a bachelor's degree. It's really how far you want to go into school and what your life allows you to do.
Yeah.
I think the last I had looked, pharmacists don't even need a bachelor's degree. They just need to take the prerequisites to get into pharmacy school, as well as, like nurses have bachelor's degrees, EMTs, paramedics do more of like a trades training school. So yeah, absolutely. There are lots of options.
All right, Tess.
Hi, I was just going to ask kind of like a general question, but what was your most memorable day of residency, and like what made it memorable to you?
I remember one specific patient my intern year who was really, really crabby with a lot of different residents. And I was kind of dreading having to go and see this patient and take care of her. And I was really wondering, how in the world was I going to be professional and keep myself together when she was just so terrible? And for some reason, when I walked in, we just clicked. And she was like the most pleasant human ever with me. And we really connected. And at the end of my time with her, she asked if I could be her primary care doctor and see her for all of her needs, which I thought was pretty remarkable and pretty validating that I had a good enough presence to talk her off of this, I don't know, mood she was in. And she continued to want to see me. So that was a really memorable part of my intern year, at least.
I think probably the best part about residency is that I think the best day of residency changes as you go on. So intern year, my best day of residency was when I did the full H&P and didn't miss any questions and, got the diagnosis right. And then you go to a different rotation and they let you do the resuscitation during a delivery. And that's the best day of residency so far. And there's so many experiences that are so different that they all kind of build on each other, and it kind of changes year to year and rotation to rotation. So I've had a lot of really, really great experiences that are really unique to residency.
And something just as simple as when you walk in the first day and you don't have to introduce yourself as, hi, I'm student doctor, or I'm the medical student. You get to say, oh, I just spent these 4 years and I am doctor now. My name's Dr. Lawler. Nice to meet you. I'll be taking care of you.
Any other memorable experiences from our panel? Okay.
I have one more. I came a little bit late. I'm Abdul, one of the internal medicine residents.
Welcome.
Thank you. So one memorable experience was in the intensive care unit. That's where kind of the sickest patients in the hospital go. And there was a patient from Romania, and he had no contacts in the United States, so we had to call overseas. And we spoke with the patient's mother. None of the family spoke any English, so we had to use a translator. And really, the way we communicated with this medical translator, and I didn't, as the doctor, or as the healthcare professional taking care of this, their family member, they really place a lot of trust in us. And so even though I didn't understand, what she was saying, I could kind of feel and really, empathize with the situation that they were in, the difficult situation that they were in, and the feelings that she was kind of expressing through her own language and through the interpreter. So, I mean, the trust and the that conversation is something that I'll carry with me for the rest of my life.
Thanks for sharing that.
Mm-hmm.
Okay, Gina.
Hi, my name's Jenna. The question I had was, what was something that you wish you knew going into medical school or fellowship, or any advice you would give to someone who was looking to go that route as well?
I think one thing for me that was helpful to tell myself, maybe not the biggest piece of advice, but something I'm looking back on is going to medical school and looking back, I would tell myself it's okay not to get perfect scores or be perfect at this. I think going through just school before medical school, we're used to hearing, you have to be top of your class, you have to get all A's to get in. And sure, it's tough and you have to get good grades to get into medical school. But I think in medical school, you're with a a lot of people who are working really hard, and it's okay if you're not, you know, the best. You'll still be a really good doctor, and you can still be a really good doctor, even if you don't get perfect scores or grades. It really is about, learning the material, but also taking care of the patients, and just using that drive and motivation to be a good doctor overall. So, yep.
Echoing what Ashley said, I would, our biggest priority is the patient. If there's something I don't know, I've done my best to learn the things I can and continue to study as best I can. And if there's something that we're bound to see at a gigantic hospital institution that has a wide variety of pathology, ask for help. I'm not here to showboat. I'm not here to try and prove anything to anybody else. My goal is to make sure that the patient's their best and treat them the best that I can. And if that involves asking, one of the specialists, or even just my attending, like, hey, I don't know what to do here. Like, that's okay. We were all in the same spot. We're all still learning. Like, ask for help and reach out.
I would say take time for yourself. Make sure you're exercising and taking care of your mental health and doing things that you enjoy. So get a coloring book, go outside for a walk, just do things to take care of yourself too, because that's the best way that you can take care of other people. You can't take care of anyone else if you're really, really struggling. So I would tell a younger me to start taking care of myself a lot younger than I had learned that.
I think just adding on to that, I would, if I could tell myself something going back, it would just be that everything is going to be okay. I think it's very easy to get stressed, especially when you're surrounded by people and everybody, you just have to look at what you are doing and focus on you only. And really everything looks big at the time, but really a lot of things that I thought were so difficult and so big, and just getting into medical school or passing medical school, taking board exams, all those things, they seem very big at the time, but in the long run, they're just all several small things. So, even if you don't do well once, there's always a second chance. Don't beat yourself over anything too much. As long as you have a goal, a vision, something you want for yourself, just keep working and not freak out too much.
Thank you. We have a question from Jada.
What is one of your most challenging cases? And I guess I'm answering like any way you can answer this is like in medical school or with a patient or residents.
Did the panel hear the question?
Yeah, I'll tell you about a challenging case. You have multiple patients that they don't really understand medicine, right? Not everybody comes into medicine with complete background literacy and understanding. And so sometimes their choices are less than desired. So it becomes very frustrating when you're telling somebody you need to take your medicine like this, or you need to try to lose weight, or you need to do the following in order to come out on the other end. And that can be very frustrating when the patient goes home and decides to do whatever they want. Sometimes it's a cultural thing, sometimes it's a lack of understanding. But for me, those are some of the most frustrating things, when I feel like I'm trying to do so much and they're not kind of meeting me in the middle.
I think there's kind of similar I think pediatrics is a very specific type of frustration, dealing with parents, especially. Everyone comes at things with a different understanding. And, in the way the world is today, there's a lot of like vaccine hesitancy and a lot of, distrust of medicine. And I think it's frustrating when you've, spent years and years trying to understand things like vaccines and why they work and all those things. And then to have someone tell you that it causes autism or something, just it gets frustrating. But I think, you just have to remember that people are really doing the best they can, especially with their kids. I think people's heads just kind of shut down when something's going on with their kids. So, being patient, I think, is probably one of the most difficult things for me in residencies. You have to be really, really, really patient, and just, slowly say the same thing every day, do the same thing every day, and hope that somehow you'll get through. But, you don't always. And then you try again the next day. So it's just, a lot of reassurance, a lot of, trying to teach, a lot of trying to do those things when it's not always that easy.
I think psychiatry is like a little different because a lot of our medication can be trial and error as well. So I think one of the hardest things for me was having certain patients that are treatment resistant, and you try a lot of things, and we're only human as well, and of course we want to help, but sometimes you do your best, and usually you can. I guess I'm thinking of one patient who had treatment resistant bipolar depression, and it just took months and months and months, and we're all only human, and we can just do the best and just try our best. And so that's hard too, especially in psychiatry, when a lot of it's like, we just have to try this, and we don't have a lot of tests to say, are you going to respond well to this medicine or not? So.
All right. Can someone on the panel talk to just the financial commitment and student loans? For getting through school?
Sure, I can start. It depends on where you go. I went to a Midwestern is more of a private. It is a private medical school, so they can, they've had higher tuition than going to like University of Illinois, or some of the state schools in other states. But I don't even know what our tuition is now. I think it's gone up since I've been there only 2 years ago, but maybe like $50,000 or $60,000 a year. But there are plenty of loans out there through student loans. I took the loans that I needed to take through the government to complete my training and to get where I am. So if you truly have a want to do it, the financial constraint should not be something to stop you.
Thank you. Any other pearls of wisdom from our panel?
I'll say as you're going into college, if this is truly or something you're interested in pursuing medicine, becoming a doctor, anything else, I think in the medical field too, get involved early. I did sit on our admission boards for the medical school, and some of the applicants are getting stronger and stronger. I sat and looked like, wow, I don't know how I got into medical school. After you see some of these applications, and it's only 4 years later. And even now in residency, as we sit and are part of the residency match, you're like, wow, these are very impressive candidates, and they were involved very early, or they, did other things. But truly show your interest, whether it's volunteering at a local health clinic or, spending time at, nursing homes or being a scribe or an MA in college. Like trying just to, one, not only show your interest, but two, see if it's something you're actually interested in. Like we said, everything that you're going to do, it's a long time commitment. So finding it out in the first couple of years rather than in the last couple of years is probably better.
Try to shadow people too. I know pre-COVID, some of you guys would come and like follow some residents around, but try to shadow people because that's how you're going to see what actually they do every day. And when you go home, you're either really excited about you maybe switching spots with that person, or you're going to be like, yeah, that's not for me anymore. So I would definitely recommend trying to shadow people. It'll also get you a lot of experience as well, get your feet wet.
I would also say if you are interested in medicine, explore other options. This is, again, a physician panel, so I want to, plug going to medical school and becoming a doctor, but at the same time, that's always the most glamorized position. And the truth is, becoming a PA, becoming a nurse, becoming a physical therapist, a nutritionist, a occupational therapist, those are all within the medical field and really great professions. So it's not becoming a doctor or nothing. If what we're describing is a lot and it sounds like a lot as we're saying it all, maybe, it's a great profession, and I'm sure it's the right profession for many of you, but for some of you, if this doesn't sound like what you want, the medical field isn't something to rule out. There's a lot of other avenues within the medical field. So just keep that in mind as well. I think I wish I knew more about other options in the medical field before I just assumed I for sure wanted to be a doctor. I never heard of occupational therapy, of things like that. So just be aware of those things as well. Becoming a therapist, since I am a psychiatrist, there's so many ways you can help and be part of mental health without going to medical school and becoming a doctor. You can be a social worker, a psychologist. So
Thank you for that. Yeah, there's a lot of avenues, and you could also join the medical education team, and we work in administration and help manage all these residency and fellowship programs. And I've been doing this for more than 3 decades, and I love it. I love medical education. So lots of options for you. So we're coming to the end of our presentation. Are there any final questions from the students or thoughts from our panel? So then I will turn it back. Oh, Daphne has a question.
So this might have been answered a little bit earlier, but what kind of lifestyle changes did any of you have to make to kind of keep up with your profession in the healthcare field?
I personally make sure that I've become very much a schedule-oriented person. When I'm at work, I try to get 100% of my work done so that when I'm at home, I'm 100% at home. That's the best way for me. Then I can focus on playing with my kid. I can exercise. I can hang out with my husband. I can do those types of things at home without worrying about work and vice versa. So I've become very much a schedule. I have everything planned out for my entire day. But that's kind of how I make sure that I have work-life balance.
I think just learning to say no to certain things too. You'll come to a point where your one day off is just wanting to sit on the couch and not go to the family party, and trying to explain those things and have that understood that, listen, I just need a day to me to unwind after being at the hospital for the past 6 days.
Yeah, I agree. I think a lot of it is time management, and just like Sophia said, I started using like my calendar a lot more than I used to, and but you can still do stuff. I mean, you will miss out on some things, but I know during my intern year, I planned my wedding, and we were able to have it during my intern year. So, yeah.
All right, well, thank you all. I'm going to hand it back over to Wendy to wrap things up.
Okay. Well, actually, Maggie, I'm sending it back to you to make the announcements of prizes or gifts.
Okay, so we have the grand prize going to Dana, Amy, Athena, Daphne, and Jada. But as Wendy said, don't lose heart. You're all going to get a token of our appreciation for being part of this learning about the journey how to become a physician. And we really enjoyed having this interaction with you all. Thank you to the panel of resident physicians for coming along and answering all the questions. And we're going to be sending these prizes over to Tess. So Tess will help us manage the distribution of these. Thank you all for participating today.
All right. Again, I just want to also say thank you to everyone for joining us. It was a pleasure to be a part of this and sharing our knowledge with you. And we hope that you are excited to go into healthcare, and we wish you the best in whatever path you choose.
I just want to say on behalf of Maine Township, thank you so much, Wendy and Maggie and all of our doctors that were here and serving on our panel today. I messaged some of you. I recognize your names and faces from actually like almost 2 years ago at this point. But it's always such a meaningful experience for our students to hear from professionals in the work industry that they're interested in going into. And I think that all the information you share is way more meaningful than the information I can give them in my classroom. So I appreciate your wisdom and you just taking the time out of your very busy schedules to be here for our students. It means a lot.
Thank you all.
Have a good day. Bye-bye.